Today we're going to talk about tendon versus neuromuscular presentations. It's important to have the right diagnosis so you see the right provider and get the right treatment or treatment options. So we're going to talk about presentations. So tendon versus muscular, they're the same structure. So when it's a resistance test or an exercise, you're going to have load on both of them, but they have different nerve endings. Muscular nerve endings can refer to the tendon. Tendons just stay where they're at. The tendon gets the most focus because that's where if you have structural challenge or damage, the body can't heal itself nearly as much as muscle. So expect them both to go to the same location. For different presentations, if you have strength with a test or an exercise, but it hurts, then if it's a tendon, they're thought to be a mild tendonitis or tendinosis. You get a little bit more leeway, but you will feel that the tension or stiffness will actually reduce as you do light activity, but will increase as you challenge it. For muscular presentations, as you do activity, it's going to just feel stronger as you go, and then it'll plateau as you continue to do the same thing. That's again if it's strong but painful. If it's weak and painful, then if it's a tendon, then it's a concern because that means it's probably a moderate tendonitis or tendinosis, and that's kind of like a hard stop on activity. There's concern that you're going to do damage and make things worse long term. So if you're doing activity and it feels one way and then you stop and it's more agitated after the fact, that again can suggest that it's a tendon. It's a question of how long. For a tendon, it may be hours. If it's muscular, while you're doing the activity, it can be cramping or throbbing. But after you get done, you can agitate for up to 2 or 3 days if you're really aggressive because the nervous system feels like it's in a danger area and is trying to tell you really need to back off, get out of danger. Weak and painless is the easiest tell, but it's the most concerning. If you're thinking about a tendon, then if you're trying to resist, but there's just no power, but no pain, that suggests that you've torn the tendon. There's no force getting through. Whereas muscular, the segment of the spine that innervates it is playing interference. It's just not letting you perform because it thinks you're going to do damage and it's trying to prevent it. But if you address the segment that's creating the weakness, then you can have strength improvement at that very same day, which isn't going to happen with a tendon. So again, the easiest tell, but the most concern if you're on the wrong structure or wrong focus. So once you identify what we're talking about or what you're looking at, then you can focus on treatment. So if it's a tendon, non-operative care or conservative care is often going to focus on inflammation control if they think it's tendonitis. So ice, anti-inflammatories, those kind of treatments. Mechanical, it can be cross-circular massage, PRP injections if you're beyond physical therapy. If it's focused on physical therapy and exercise, then you're going to do eccentric or slowly losing gravity in a slow way to minimize tugging on the tendon. You're going to be slow, but you're going to be aggressive in your load progression. If it's muscular, then you're going to be slow both with motion and the volume and just total load, so the nervous system isn't overwhelmed. Procedure-wise, you can do foam rolling, ischemic compression, or dry needling. Again, the focus of getting the right diagnosis or understanding is you treat the structure that needs treatment. Doing the opposite one won't see any progress.